All right, we're here. We're live. And this is Dr. Tony. I'm the host of Crooked Spine Show. I have my phenomenal guest, Megan Bliss, today. She focuses on hormone rebalancing, helping women especially understand what's causing their weight gain, what's causing them to become overly stressed, what's causing. I have patients who come in with headaches. Someone this morning that came in and said, my weight gain, even though I'm working out, is not getting better. So I want Megan to explain for me, because I don't even know how hormones work to cause these issues, especially in women, and how to regain that balance to help women especially regain their lives. All right. So Megan, give you a quick intro, see what's going on.
Yeah. So it's one of the most frustrating things for women too.
Mhm.
You know, it's in society's like all about, looking a certain way. And so it gets frustrating when women are trying to do all the right things
Yes.
and nothing is working. But a lot of times hormones can be a very, very integral aspect of that
Mhm.
happening, and what can happen, and a lot of times they're not listened to from their conventional practitioners, and all of that. So what can happen, and it takes balance. It takes a little bit of this and enough of that, and it really takes these hormones being imbalanced. And when I say hormones, there's so many hormones in the body, but the general kind of understanding when I say hormones is basically the sex hormones, the steroid hormones, is what I'm usually referring to in that aspect. But that's going to be like your estrogen, progesterone, testosterone, DHEA, and then I do a lot of focus on cortisol, and then also thyroid in the mix there, because those typically are the ones that affect weight predominantly in women.
And that's what I see too. A lot of people understand is when hormones are off, your overall body's off.
Mm-hmm.
And that can just a feedback loop to where now your body self-regulates to make that your normal. How do we get people to break that cycle, Megan, so overall people can get better without, like you had mentioned earlier, mentioned show notes too, is not getting on medications, not having surgeries, antidepressants, because it's not the problem. It may make you feel better, even weight loss programs too, but it's not the source of the problem. So with yours, what causes a hormone imbalance? What usually causes that to happen?
And it's multifactorial. I mean, obviously our genetics play a role in that, but I always like to mention how genes are really only about 10% of the actual outcome, and there's so much that we've got in our control. Our nutrition is huge when it comes to keeping hormones in balance. We've got to make sure we've got the right nutrients so that the hormone receptor sites can even accept what hormones our body is producing, and then that also affects our stress and our insulin levels. Insulin is another hormone that's a huge aspect of things. And so nutrition, our stress levels is another big thing. Cortisol, which is one of the stress hormones, definitely affects so many aspects of life. It alters our sex hormones if things are too high or too low. So stress is another huge key factor. Movement is big with the whole detox process and staying regulated with hormones. So it really takes finding a recipe that is individual for each person. And medications just don't cover that. They're just like symptom suppression. We're just going to put you on this medication. Sure, it might help out with some of the symptoms, but it doesn't really get down to the root cause of it. And hysterectomies is another thing. A lot of women go in for hysterectomies, and while yes, it takes out the problem of the bleeding, but it's not really getting down to all the imbalances. And there are so many receptor sites in the body for hormones. It's not just in the uterus. So it's not helping out with anxiety and depression and insomnia, all of that stuff.
And going back to nutrition too, are there certain foods to avoid or include in your diet to help keep your hormones balanced?
Well, yeah, highly processed foods, flours and sugars are not great for our hormones at all. And that's usually where I like to focus. And I like to go on more of a strength-based approach and not restricting, but my initial things are avoiding the highly processed refined flours and sugars, and just adding in a whole bunch of vegetables into nutrition. Yeah, that's usually where I like to start instead of restricting other food categories.
And why do people, when they have hormonal imbalances and or stress and anxiety, like the processed foods, stay away from vegetables, stay away from the good foods, the healthy foods? Why do they do that?
It's kind of like a revolving door, the highly processed foods make your hormones out of whack, and then having out of whacked hormones makes your stress levels go up, and your body craves things that taste good or feel good or all of that. And then you eat more of that, which makes things worse. And so you get stuck in this revolving, or a hamster wheel, I guess, of where things just keep catapulting. So it's kind of a vicious cycle.
It's one of those things where when I speak to people too about their stress levels, you want to feel uncomfortable. So eating processed food has made you comfortable, made you have this situation. It may be anything. How do we break that cycle so you're uncomfortable? Because you have to eat more vegetables, more fruits, healthier foods for you. Maybe staying away from the red meats, pork, whatever it might be. The French fries, like Allie, our co-friend, Allie loves French fries. Okay, let's talk about French fries. I love French fries too, but they may not be the best thing for you if you have these balances going on. But it's going to make you feel uncomfortable not to have the foods that you like to eat, because it makes your hormones, the stress hormones, catecholamine, cortisol, want to increase, which is causing your problem in the first place. So can we change that? And how long does it take from just a diet perspective for someone to see a difference to when they change that? Like anywhere from 3 to 4 weeks or even longer? How was it?
Everybody's a little bit different, and it kind of depends on how sucky everything, their whole process is. But I mean, I was just chatting with a gal I'm working with earlier today, and we did some food sensitivity testing on her, and she started really focusing on adding in lots of vegetables that she knew were good for her, and then kind of eliminating the things that weren't necessarily fueling her. And she said, I was so surprised within just a few days, I was noticing a difference. And she said, it baffles me because it's just been right in front of me this whole time, and I haven't recognized it. And I'm like, yeah, it happens.
But you have a system that you use with your clients to help them. Okay, this isn't working. Let's try this. So you're seeing someone's health from a perspective up here, a bird's eye view, versus what's in front of you. You can't see things. That's normal humans, right?
Yeah, a lot of times it takes that third party, objective eye to be able to be like, yeah, let's start here, and maybe that won't be overwhelming for you, and definitely take it in a personalized approach.
Well, that's the thing. And talk about doing food sensitivity tests. What else is a good way to, I guess, just know your hormones are off? What's a good test to normally do, say medically or even outside the medical field?
Yeah, so I use a saliva testing is what I use. It's my preferred method, unless people are getting sublingual hormonal intervention. There's a few caveats to that, but I prefer saliva testing. There's also the Dutch test. It's not one that I use, but it's very commonly used as the Dutch test.
What's the Dutch test? I don't know.
It looks at all the hormone metabolites and where kind of the reactions are, and where hormone pathways maybe are interrupted or working in overdrive. So that's another common one. But I really like, and there are tests, like I think Everlywell has a hormone test that you can just do at home. But a lot of times when people aren't skilled at looking at these tests, they'll even take it into their general practitioners, and they're like, well, I don't know what to do with this. Here's a test, and so it really takes working with somebody that knows how to interpret it and where to go from there.
It's and having experience too, correct? This may be off, but okay, why is this off? And how do we now correct this? Versus, like you had mentioned before, but we don't mention, is medication is not the answer to fix your hormones, because it's not a medication deficiency causing your hormone imbalance.
Right. Yeah.
And again, that makes sense to us, but someone who's under stress and is going to go see my doctor, let's help them see a different way to actually fix the problem, not just feel better.
Right. And that's where it's kind of a tough situation, because they're, unfortunately, typical providers. And I remember being told, fresh out of school, and I get messages all the time from people who are just getting out of schooling. They're like, help me with hormones, because they did not cover this in my education. And I'm like, okay, so tell me, you just barely graduated. How much training did you get on this matter? And they said, pretty much, if there's a hormonal imbalance, put them on birth control.
Yeah.
And
Bye-bye. Yeah.
Yeah. So it's just so sad. And I remember being told, that it's not worth testing hormones because hormones fluctuate too frequently. And I think it's just these myths that keep getting passed down from mentor down the line, and it's just really sad and it has not done women or men any services.
It's amazing when they close a blind eye, anyone does, versus let me actually figure this thing out, versus let me bring in the experts, versus we'll just teach them this.
Right. I remember too being stuck in that model and having 30 patients in a day. I only had like 10 to 15 minutes with each patient. And it was like, I was overwhelmed too in my profession. And I was like, I've got to be able to get home to my kids tonight. I can't be working all night long. So what is something that I know that is going to help them feel a little bit better? And so they don't feel like they wasted their time coming in. And so I remember being stuck from this end in that, but hating every second of it.
It's almost, you got to tell students, okay, you're going to learn the book knowledge to pass your test, get your certification, get your license. Then we're going to teach you how the real world works. And you're going to learn how to help people, not just pass a pill.
Yeah. And it takes a while to get to that point, to really understand processes. And I think it takes the passion too, to behind it, so that you're like not going to continually be trapped in that.
You're actually going to help people. That's if you have that passion to help people. Okay, maybe the book knowledge, the lecture you had isn't very helpful because that was great about 10 years ago, but not anymore.
And unfortunately, it takes that long for things to evolve in the medical field, right?
It takes people like yourself, like clients, like patients going, hey, look, this didn't help me. Your birth control didn't help me. This is what helped me. And over time, now people say like, crap, we better teach our students this. We better learn this ourselves. Because they're going outside of our healthcare to get healthcare. And that's hurting our business. That's hurting our dollars from getting their dollars instead of someone else getting their dollars. It comes down to that, right?
Yep.
That's how the world, that's how capitalism works in USA. Switching topics too, Megan. How do we help women that are gaining we talk about weight gain, even they're doing the right things to work out, to eat better? How does that work with weight gain with hormones?
I think that's where getting some data is very, very helpful in getting the testing. So then you can really streamline it and be like, okay, here's where we need to do some balancing. And this nutrition, because there's certain nutritional aspects that are going to be better for certain hormone balancing versus others. And so I really feel like it's definitely a personalized approach. And getting data is so nice to be able to be like, okay, instead of guessing and being like, oh, I'm just going to take this hormone balancing supplement or whatever, that's kind of blindly supplementing. So I really like strategic supplementing and streamlining from there, because I really feel like that data is just very validating and almost empowering too.
We can almost retest again 3 or 4 months later and also see the improvement, because not only has the patient improved, but the hormones improved also.
Yep.
Wow.
Yep. And it's so nice. It's so nice to just have that clear path so that you're not continually guessing.
And with the stress that comes with being having an hormonal imbalance, how do you help clients deal with that?
So I mean, I've got some stress reduction tactics that I do, but I also definitely encourage working with a good counselor or therapist or something like that to be able to have some interrupting, to interrupt those thought processes when maybe you're spiraling in your mind out of control and all of that. So I think that's a collaborative effort as well.
Well, I'm glad you're thinking about the person's whole well-being, not just if you do this, everything's going to be fixed. And they may need that therapy, may need that coaching, that stress relieving techniques over a period of maybe 3 or 4 months till your body gets the hormones rebalanced and they can actually feel they can handle that stressor again, right?
Yeah. And then they have the tools that are going to last them a lifetime to be able to interrupt that. And stress is one of the biggest causes of hormonal imbalances. And if you're able to manage your stress, and we live in a very stressful culture, and so if we're able to have some tools in our arsenal to be able to interrupt our thought processes, because our bodies don't know that a saber-toothed tiger isn't coming at us. it just knows that stress is happening, whether it's a predator or just the busyness of our fast-paced lives. It just spikes those stress hormones, and we need to be able to have some tools to interrupt that process so our body doesn't feel the effects.
I don't know how many patients I have that have come in and told me to decrease my stress, I have to quit my job, kick the dog out, leave my family, move to another state. That's not practical. Why don't we just teach our patients, our clients, to get a better state of health so they can handle that stressors of their day, maybe having another kid, a job change, whatever it is. So, and over time, their body doesn't have to react to that from a
Yes.
physical standpoint.
Yes, 100%, 100%. Why have the mentality of having to completely step away from life as we know it, instead having mechanisms in place?
Yes. And what else do you teach your clients, say at a certain level or different levels, to help them with self tactics to help themselves, I guess, keep that stress level down, keep the hormones balanced, whatever it might be? How do you usually work with a client like that?
We find out, I like to do a SWOT analysis in all things and figure out where their strengths are, where their weaknesses are, find some opportunities for growth and development, and then find the things that are threats that maybe aren't in their control, and then figure out the tactics that are going to work in each of those areas, and obviously finding some good self-care is super, super important. I consider chiropractic care a good form of self-care for people, and I know a lot of clients that have had amazing results with chiropractic care and incorporating that into their little recipe of goodness.
We talked about earlier the saber-tooth tiger. It's the fight or flight mechanism of the body, right? How do we get that to calm down so now the whole body can rebalance itself and re-regulate? So at that point, what you're doing with your clients, what I'm doing, that complements each other versus fight each other.
Oh yeah, 100% can be very, very complementary to finding just total body wellness.
Yes. And what you mentioned earlier too, motion. How does motion help rebalance the hormones or keep things balanced?
Motion, I mean, I know you know this too. Like, it's so important with every decade of life. Being mobile and having good mobility and all that is so, so important, because and that's multifactorial too. It helps in the detox process to detoxify excess hormones that our body is holding on to. So it's huge in that aspect. Muscle growth is huge. And being able to help in the detox process too. But then also that mobility and the movement is less of a stress on our bodies, and it all comes back down to stress. When our bodies aren't mobile and aren't strong, it's a stress to our bodies, and that makes things out of whack.
We talked earlier too about how our stressors of our day, the physicality of it, we have to be able to handle that stress of the day. If our hormones are off, at that point, when we don't move enough, we're not breaking down the catecholamines, cortisol. We're not building up the adrenaline and the endorphins to help our body become less stressed. But the problem is, when we're stressed, we want to do this. We want to do a thing. We have to fight that feeling, I think, to make our bodies move, so that movement feels good over time.
Yeah, and it doesn't initially.
It's eating those better foods. You're going to feel uncomfortable because you're doing something different. If you want your health to change, you have to do something different, right? We have to be uncomfortable. So, and when I hear someone say, man, I did the exercise and it feels okay. When I hear them say, I did the exercise and it feels good, I go, good, now we've got it. Now they're feeling that emotional, that hormonal, that chemical change in their body to start to re-regulating things. And when someone asks you, why does it take so long? Or what's the length of time? How do you answer that? Because a lot of it I get is, I'll tell someone, it may take you 4 weeks, it may take you 6 weeks, but until you tell me you can work out and you feel a need, if you miss a day, you're like, dang, I missed a day, because it makes me feel like I want to stay there. What's it take for your clients? How do you present that length of time for clients?
Really, when it comes to movement and mobility, I tell them it's got to get to a point where it's just something you do, like breathing, like sleeping, you do it. And it can take some time. Like, I've worked with clients who have been so run down, cortisol in the toilet, hormones in the toilet and everything. And they just cannot get that runner's high from exercise, and it can take a while for those imbalances to improve depending on how in the toilet bowl they are, and so I mean, I've even worked with somebody who is going on 3 to 6 months who is still not having that runner's high. However, they have started to just, it's a part of their day. They just it's discipline. And so that's what I tell them, not to necessarily focus so much on the feeling of exercise, but just get into the habit of it's a part of your day. And then over time, it'll get to that point where you don't want to miss it.
Oh, I think a lot of when you get that point too, I'm gonna trust Megan. She knows what she's talking about. Let me just keep doing it. So at that point, I don't care how I feel. I'm just gonna do it because I have to do it. That's great. That's fantastic.
Yeah.
With what you do too, because I did show a peer of mine who talks about adrenal fatigue. Is that the same thing or is that something different?
So yeah, adrenal fatigue, and it's obviously not medically like recognized or whatever. But when that cortisol is in the toilet, I mean, I've seen countless people who just feel awful and sluggish. And a lot of times they've lived in that overdrive mode for so long, and then things just crash. Or there's other hormonal imbalances, like they don't have enough DHEA and then they can't, and that correlates with that low cortisol too. Or they don't have enough nutrients in order to keep things replenished. So it is exhausting and doesn't feel good. Immune system sucks. And we all know immune system right now is super, super important. Yeah. So yeah, it can be kind of sometimes I'm like, it's a little bit harder to crawl out of even then when things are in overdrive.
And what does it take for someone to, how long do you want someone, not someone to wait, but what time frame do someone have an hormone imbalance where it actually changes their stress level, their weight gain? Is it 3 or 4 months, or what does it take to know that their balance is off?
Well, it depends, but most people, we're noticing a difference within the first 3 months of implementing change. Okay. Other people where things are more, and I like to do a very intense, focused 3 to 6 months in the beginning to really establish routines and get down to the bottom of things. But some people who are very sick, it can take a little while to get out of. And as long as they don't have additional stressors, saber-tooth tigers, coming at them, progress is good and can happen. But most people, it's within 3 to 6 months, we're making some really good headway.
What are common symptoms that people should look for in their health that are signs of they're having hormonal imbalance? Besides the weight gain, overly stressed, what else would you want them to kind of, if there's a checklist to look for?
Right. Yeah. And I have a checklist, and I've got it at checkhormones.com. That's a pretty comprehensive one and will kind of help you determine maybe some hormonal imbalances that you've got. But I like to think about it as like there's billboard symptoms. Okay. And a lot of women wait until it gets to those billboard symptoms. Okay. Those billboard symptoms are the things that, people can see. So those main ones are going to be, yes, the weight gain.
Okay.
That's a billboard symptom. Hair loss. Women are very concerned about their hair falling out. So hair loss is another one that sometimes drives women to come see me. Skin issues, acne, rashes, stuff like that can also be an issue. But I like to say, and I preach this all the time, like we got to get to it before it gets to be those billboard issues. So that's going to be menstrual irregularities, not sleeping well at night, trying to sleep, but they're having a hard time falling asleep or staying asleep. Obviously, there's the menopausal symptoms like hot flashes, vaginal dryness, all of that. But I feel like the younger demographics almost get misunderstood and lost in translation. And that's going to be the terribly heavy periods. Cramping is not normal. Yes, acne is in there too. Not sleeping well, irritability, the depression, anxiety, things like that are things that we should be paying attention to way before it gets to the billboard symptoms.
Headaches, is that one of the symptoms?
Yep. Headaches are a big one, especially with women with elevated estrogen.
Okay. And what kind of headaches would they be?
Usually they're tension headaches, but a lot of times they get to the migraine point and it just kind of tips them over into that migraine type of situation, which is not fun at all.
And one thing too, when my patient brought it up too, I think for her daughter, is her daughter's pregnant. and she's never had headaches before. How
So-
does hormonal imbalances with pregnant women help?
Yeah, so it's really funny. You'll see with a lot of women where it's either they feel the way better than they've ever felt their entire lives when they're pregnant, or they feel absolutely miserable. And when women are pregnant, they get the super influx of estrogen and progesterone. And if there's kind of a baseline imbalance just regularly,
Without the pregnancy.
yeah, without the pregnancy, if you influx that much estrogen into things, most of those women feel terrible during pregnancy. Migraines, lots of nausea, vomiting, gut issues, because gut and hormones are very, very intertwined.
Huge. And talk to me about, and again, I saw on your free hormone symptom checklist on your website. What is that again?
So the website?
Yes, the checklist on your website? Yes.
Yeah. Checkhormones.com is where that's at. And I break down common symptoms in like a lot of the imbalances that we see, whether it's low progesterone, elevated estrogen, low androgen, so testosterone or high, cortisol imbalances too. So I go through the common symptoms in each of those and kind of how to determine where it may, but a lot of symptoms overlap too, which is why I like the data. There's a lot of symptom overlapping, and it's like, well, how do I know which one exactly? And that's where you dig in to get the data.
And that's what I would do. I'd go, I see the checklist. I have a few things there. I'm going to call Megan. How's that?
Yeah, exactly.
Easier. Why? I'm not a hormone specialist. Megan, easy.
Yeah, and I've got lots of chiropractors here locally that actually refer patients to me.
Easy. And I put all the stuff on the show notes. It's all on there, her website or Instagram. The checklist also to the link directly to that from one too. Anything I missed today, Megan, that usually you bring on a show or you want to bring out there or let people know?
Oh, I could talk about hormones all day. But I guess one thing that I think a lot of women ignore as a symptom, and I didn't mention this one, but libido is a big issue. And a lot of women ignore that because they just think that it's not a big deal or whatever. But their significant others think it's a big deal. And I think it is a warning sign that your body is off and needs to be looked at, or some counseling needs to be done, because that's very multifactorial too. But that's another thing that can be definitely a warning sign before it gets to the point of the billboard symptoms.
And with yours, when you talk to someone, okay, I'm going to start this person as a client, what's your assessment? What's your first day process?
My first day process is I do a really deep dive timeline, thorough dig at all the assessments. So we map out basically their entire lives from their mother's health before pregnancy all the way up to the present point. And we pinpoint certain life events, when symptoms started, illnesses, traumatic incidences, all that. So we're doing a lot of mapping the first time and then figuring out symptoms and where they place on everything. And so that's usually my big one. And everything I do virtually. So.
And you mentioned the saliva test too, correct? Or the testing, is that the same day, or you send them the test, or how does that?
Well, we're usually assessing kind of when to test, because we do have to make sure that the timing of that testing is very accurate according to cycle, if they are cycling, all of that. So it's a little bit of a process, but it's fun.
Good. And the women, you guys can talk about stuff all day long. Great.
Yep.
Anything else you want to mention for the show?
Oh, I don't think so, unless you've got anything else.
And my biggest thing is why should women call you now before they have those major health issues versus, okay, I did checklist online. I said, what's going on? Something's going on. I was going to call Megan and see if it's a concern or not. Why not?
Because things can spiral and they can get worse. When you ignore things and brush it under the rug, those hormone imbalances can get worse, especially if you haven't interrupted some of the contributing processes. They can get worse and they can spiral. And hormonal imbalances play a factor in every aspect of disease in life, whether that be heart disease, dementia, Alzheimer's. It's huge with our long-term health effects. I actually just lost a friend of mine this week to breast cancer, and which she's been battling for several years. And I just feel this huge, deep desire in me because that's such a huge part of breast cancer is hormone imbalances can be a triggering factor with it. And it's just, I don't want any family or friend to ever have to go through that.
Good. And I think a lot of it is when you're talking about someone's health, you're mapping it out for when they were pre-birth. you're seeing the whole process along with hereditary factors, along with other things too. You can help someone with long-term conditions, maybe Alzheimer's disease, dementia, breast cancer, other cancers too, avoid those and bring the risk down.
Oh, yes, significantly.
So so basically what you're doing is helping anybody, symptom or not, understand where they are now. So even being preventive, getting a saliva test done, doing an exam with you too, would prevent things from happening 15, 20 years later.
100%. It's a form of preventative medicine.
Good. And that's what people understand, is by taking care of your health naturally allows you not to have those long-term problems. So thank you for the show. Anything else you want to bring up?
Thank you so much for having me, Dr. Tony. I appreciate it.
No, I'll turn the show off. We'll talk a couple more minutes. Okay. Thanks, guys, for watching. Appreciate it.